watching AYV Television.
Good evening, viewers. Happy New Year. Welcome to the first episode of the Women's Place Show for 2020. This is your weekly women's health program coming to you live on Channel 33 AYV Television. I am your host, Dr. Frances Ramatu-Wuri-Sise, obstetrician gynecologist. We are currently streaming live on ayvnews.com, and our Facebook page at The Woman's Place is looking forward to receiving your questions and comments as we proceed with the show. As always, you can call us on 025-271-959, and you can contact us via AYV's Facebook page as well. Our topic of discussion this evening is women's health and drugs. We can all agree that weak regulatory mechanisms with regards to drug sales in Sierra Leone put many women at risk of drug-to-drug interaction and potential life-threatening side effects. In addition, women face unique issues when it comes to substance abuse when compared to men. This in part is influenced by differences based on biology and differences based on culturally defined roles for women and men. To help me talk about this issue, I have in the studio tonight pharmacist Marie Khalifa Kamara and pharmacist Shwari Balat. Fam Kamara, Khalifa Kamara. Kindly say good evening to our viewers.
Good evening, viewers.
Okay. And Fam Balat, kindly say good evening to our viewers.
Good evening, viewers.
All right. So I'm going to start with you, from Khalifa Kamara. I have to keep remembering that. How can we categorize these drugs? I have just said drugs in general. How do we categorize drugs?
Okay. We have mostly 3 categories of drugs.
Okay.
We have OTC, which is over the counter. It's basically drugs you can get from pharmacy. You can even get them from drugstore, patent store, and even in supermarkets. So you can get it everywhere.
Everywhere, okay.
Yes. So you don't need anything like a prescription from a prescriber, a physician for that.
Okay.
You just go and get them.
Okay.
So examples of such drugs are like your paracetamol.
Okay.
Like for women, we are taking the Fifol, for example, the ferrous and folic acid. So those are all over the counter. You can get them anywhere. Okay. Except for the streets.
Yes, I guess. Registered pharmacies.
Registered places. Yes. Because even when they are in the supermarkets, they are being regulated.
Okay.
Because that's the difference. Even though they are over the counter, they are still being under regulation.
Okay, that's a good point.
Yes. And then we have drugs that we call prescription drugs.
Right.
So for prescription drugs, you need authentic prescription from a prescriber.
Okay.
Basically from a medical doctor. They have to prescribe that you need this based on the conditions that they have seen.
Exactly.
So you need the prescription to go to the pharmacy, and you cannot just find them everywhere. Those type of drugs.
Right.
And we have drugs that we classify as illicit drugs.
Okay.
They are prohibited. We are not, by law, we are not supposed to take them. They are prohibited. You happen to have some prescription drugs that are now referred to as illicit drugs because they are prohibited not to take ever again.
Exactly.
Yes. So these are the three main
types of drugs that we have. Okay, that's a good one. So from Balat, we just started. The title of the topic of the show today is women's health and drugs in general, but we're basically talking about drug abuse and drug misuse. Can you kindly take us through those two terms, drug abuse and drug misuse? What do we mean when we talk about those?
Well, drug abuse and drug misuse, most times people try to say they're the same, but quite different.
Okay.
Misuse, a prescriber prescribe your drug, and then you happen to use them not as directed.
Okay.
So
as you feel like.
As you feel like. So, for example, you say you should take this certain dose at this time, you try to double the dose. You try to give a friend to take the same medication that's prohibited.
Okay.
The wrong timing, all those are drug misuse. Or their prescription given to it.
Okay.
For drug abuse, no prescription is handed out, and then you tend to use the drug to get a high, illegal high. For example, now the youths using this tramadol and sort of medication. You can get also you abuse painkillers.
Right.
This is most common.
Okay.
So all those are parts of not giving a prescription, but you use them and you get addicted to them.
Right.
Which I'm sure we'll discuss further.
That's a good distinction for us to make, for us to be able to know what we mean when we talk about drug abuse and drug misuse. So basically, he has made that distinction. So I hope you have gotten that message. But this is a women's health show. For sure, we talk about general health, but this is the women's health show. We see that studies have said that women are at highest risk for developing substance abuse during their reproductive years. So basically, these women who are either pregnant or about to get pregnant, those are the ones that are more likely to be using these illicit drugs that we've discussed. From Khalifa Kamara, why do you think women are at risk of developing substance abuse?
Okay. Because of the genetic makeup, I'll start with. The physiology of the human and the woman body is somehow different from the physiology of the men. So one key thing that I want to start with is basically sex hormones.
Okay.
Sex hormones plays a great role in the way we react as women to drugs. For instance, if a man is here and a woman and they're taking alcohol, just a bottle or two can get the woman to a drunken state,
right,
whereas the man can take up to 6, 7. Okay. So our sex hormones within us is influencing the way we react to illicit drugs. It most times increases the metabolism of the drugs.
It makes it
breaks it down.
Okay.
Yes.
So you think women will be more sensitive?
Sensitive.
Okay.
And even the sex hormones, there have been studies that have shown that it also helps increase pain sensitivity. Okay. That is why you see women are more prone to pain than men.
Okay.
And that's why in most cases when women are abusing drugs, they tend to abuse painkillers. Because
that's a good one.
We are almost always in pain, considering both the physiology and then even the stress. You have a woman, the children are there, other things and the like. So we have so many factors that contribute in weakening our immunity. And so we are exposed to so many risks.
Okay, that's true. I mean, it's good that you've brought out some sort of family life, but also psychosocial stress, as you're talking about. You think about divorce. If a woman is going through a divorce, has lost a child, if a woman is dealing with the death of a partner, all of those things are things that would predispose her to start using these illicit drugs that we're talking about. And did you want to add something? Oh, I thought you'd do a message.
Well, I mean, concerning she's saying women all the time, but
yes,
men also.
That's true. Thank you for bringing that up. Thank
men
you for bringing that up.
With stress of life, and we also get addicted to painkillers and the rest. So it's
a balance.
Let's make it 50-50.
General, yeah. No, it's general for sure. It's a women's health show, but definitely we are concerned about the health of our male counterparts. We were just basically trying to discuss, I guess, everything that a woman would go through in that regard in terms of divorce or death of a child or death of a partner. Same thing would apply to the male. So you're right, Fambala. Thank you for that. We have some sociocultural factors that would influence the use of drugs, especially in this country. Take us through that, Fambalat. What do you think those are? Well,
if I can just piggyback what Mary was saying, stress is one issue. So, I mean, stress can make somebody to substance abuse. And most in the society, alcohol is the main reason. And then you have the youth now going on legal high, they're taking tramadol and the rest, and this new phenomenon of Pampers, all this stress just to have this legal high, and then it affects the society because especially teenagers, you don't go to school, there's this you don't from society, and then increased violence, all the rest of it. And then you find out it happens, generation passed down to, if the kids seeing the mother abusing dogs, definitely you just piggyback on that. So it's a situation of social, cultural problem which a lot of counseling and family support need to be involved.
Yeah. So definitely, as you were saying, but we also take into consideration our social fabric. I mean, we have some we had a show about adolescent health, and mental health when it comes to adolescence is such an important thing. In general, we feel like these are taboo subjects when we talk about drug abuse. There are things that probably we talk about in silence and we don't want to openly communicate about. So it's important that we start talking about these things so people can get the help that they need, for sure. Not to leave out the men, but I'm going to ask a question to Khalifa Kamara. These drugs, especially when we're talking about illicit drugs, they have far-reaching effects on the health of women. Yeah. What are some of these effects that we have?
Okay. At first, I've already talked about our makeup as a woman, and so the way drugs will affect us might be the same for men, but we are more prone to it. Okay. Even we have the issue of, saying, telescoping. If I'm taking cocaine, for instance, as a woman, I will react faster to get to dependency issue than a man. Okay. Yes. So it's mostly affects our entire system. So for a woman of reproductive age, or let's say you're pregnant, taking illicit drugs will not only have effect on you, but will also have effect on the baby. Because in most cases, most of those drugs are crossing our placenta, which is the cord that connects us as mother and the baby. And we also, some illicit drugs, in most time, because we are stressed, we cannot sleep, we want to sleep, so we tend to take and depressants and drugs. And so all of these have issues with respect to our heart rates, our blood pressure, increase other cardiovascular factors, and also affecting our reproductive organs as well. Right. So there are so many factors that's linked to the use of drugs with respect to women. Right.
Fam Balat, anything you want to add in?
Well, apart from illicit drugs, also we have even prescription drugs that can affect
health,
the baby.
Yeah.
You know, they cross the placenta, and some drugs, the doctor will definitely tell you do not take these drugs, even manufacturer advice, do not take them in pregnancy. That these are prescription drugs. And also after you give birth, some of the drugs also are very dangerous. They cross, get to the breast milk. And so also you need to be very aware of those and advise the patient not to take drugs without doctor's advice or prescriber's advice. That's very, very important.
Okay, thank you both. But let's just, as from Kamara has said, compared to men, it takes a shorter time for women and less alcohol for them to develop long-term, like for example, liver disease. So it's important, that's a vital thing, as much as it affects males and females, but the effects for females are somehow worse. But also, as she said, infertility, long-term use with regards to cancers, heart disease, as she said. But when it comes to women of reproductive age, for example, we want to talk about hormonal imbalance that these medications will cause. We want to talk about menstrual irregularities as well. And then early menopause, for sure, if you're taking illicit medication, you might have premature ovarian failure. So it's not just for here and now, that immediate high that you will get, right? You have like far-reaching effects as well. So you've actually started talking about something when you said the side effects of drugs. There are some prescription medication that we used to use before when it comes that had effects on the babies. Can you just take us through those?
Well, not the current thing in use.
Okay.
Thalidomide, that's presently not being used.
Right.
Because in 1961, this drug happened. Just take view as quickly what happened, and then it happened. The drug released to prevent sleeping, morning sickness. You know, women usually when they're pregnant, they have all these physiological effects.
Exactly.
They vomit a lot. So it was like a miracle drug.
Exactly.
But then, at that time, they failed to take the drug 2 hours after giving birth. What will happen?
Right.
So 9 months later, you start giving, babies start coming out with limb defects, no limb. You find out no monofit. I can always remember there's a popular BBC presenter, Frederick Dove. He's a thalidomide sufferer.
Maybe you should Google that if you can.
Short limbs.
So you see.
So that happened, and I usually say United States was the only country that didn't approve that drug at that time.
Okay.
So the women were saved and were spared for that side effect.
But they were being used in other places.
So the drug was banned immediately. So that's how the whole essence of pharmacovigilance, monitoring dog, even after they've been produced, come into effect.
So you monitor,
so you monitor dog, not even during manufacturing stage, clinical trials, but after one has been released into the markets.
Okay.
You carry out post-market surveillance and then a reporting mechanism in which those side effects must be reported to a particular center and then regular reports sent to WHO. Because that's why if you notice on a quarterly or yearly basis, WHO do release a drug list of products that have new side effects that have come for the reporting mechanism.
So it changes as it goes
so, if you look, so it's always a reporting and ongoing process.
But you mentioned drugs that are being prescribed currently, like which ones?
For example, chloramphenicol is one that should not give. This is a prescription drug which the prescriber must tell you that if you give to the baby, it causes great baby syndrome. And then you have...
So we're talking about using it if you're not pregnant but you can't use it in pregnancy. Yes. Okay.
Example. And even some that come into the breast milk after you have given birth, they have the metronidazole. And even these illicit drugs like meth. When you take it, you go directly into the breast milk and then the baby do take the drug because most cases death. Because then you overload the liver and the baby organ is so premature, cannot metabolize the drug properly. So in most cases, the baby dies. So that's most of the reason why if you're not seeing your prescriber, make sure there is a counseling mechanism in which mostly from family for dog users to continue to tell them that these dogs should not be used when you're pregnant. These dogs outright banning in some cases. So that's all in part of the counseling mechanism as professionals.
Yeah. It's also important to note, I mean, as you're saying, drugs that are being prescribed now, if you're hypertensive and there are certain drugs that you're taking that could have effects on the baby. Same way if you're diabetic, there are certain medications that you should not be taking if you're pregnant. So it's important to discuss with your doctor, especially if you suspect that you're pregnant, especially during those early months, because that's when all those organs are being formed. So it's important that you have a medical personnel, that you can go and speak to about your medical condition, so they can tell you which drugs to take or not to take. So from Balat, going back to you, what are the statistics with regards to drug abuse in Sierra Leone? Do we have any?
Well, maybe they are there, but I won't access any. I was doing some research, but I remember a while back I spoke to the physician at the Sierra Leone Psychiatric Hospital. Okay, Dr. Jalo. And I also visited the hospital at that time, and most of the men in the ward were there because of substance abuse. Substance abuse. Sure. Okay. And it was there they told me about they're doing petrol, sniffing petrol, mixing concussion, petrol, and even tramadol. They are not even using tramadol alone. They're mixing it with other alcohol, some various they are playing chemistry. I usually say our youths are they're very innovative when they want to they get high. Exactly. So what all these issues, but if you go to the world, you see them there. So these are clear and present. And even on the streets, you see some crazy people. You know that these have to do with some drug use, marijuana or. So we don't have any statistics in Sierra Leone for sure. But what were you going to say?
Yeah. Maybe if I can comment on this please. One. There is.
Oh, there is.
Very few.
Okay.
And in most cases, we are not that research oriented.
Especially when it comes to that area, I would imagine.
Yes. So there was a study done by WHO, and mostly it was for Africa. And they found out that about 5.2% of drug abuse happened in West Africa, to be specific. And for Sierra Leone, there are three main products that we are abusing. Okay. Marijuana, yes, cocaine and heroin. But again, it depends on the age category. There was also another study that was done by the National Drug Law Enforcement Agency back in 2013. Okay. So they did some sort of a survey, interviewing about 3,500 respondents. Okay. And they discovered that about 25% of those that they interviewed had or are still taking illicit drugs. And marijuana is the number one. Okay. And cocaine is also there, about 2%. So taking cocaine. And again, yes. Okay. And you know, the percentage will be lesser for cocaine because of cost. The cost, sure. Yes. And
availability.
Yes. And they did that for people within the ages of 14 to 60. And for those that are taking cocaine, they are around between 40 to 60. So they are the big guys. So there is, but very, very, very little research.
That's a good point, because I mean, when we think about drug abuse in general, we're thinking, you know, young people, and for you to bring up that point that, you know, older people are also abusing drugs, that's a very valid point. So thank you for that, from Khalifa Kamara. So we've talked about drug abuse, but there's also drug addiction, and I know there are different stages. From Balat, just let us know what that is.
Well, before you get to the addiction stage, usually it starts with experiments.
Yeah, that's usually,
mostly with teenagers, and you are just taking it for fun, and then it gets to regular use, the next stage, start taking it, and then for regular use now you get to tolerance stage in which you're taking the drug. Before the regular use, you can always stop taking it. You have that control.
Yeah, so maybe once in a while, maybe in social circumstances.
When it gets to the tolerance stage, you cannot, because now you're like hooked. The tolerance stage and the dependency stage is where you take the drug. There are legal consequences, but you cannot stop. Because now it's a slim, then you get into the addiction stage. And then you get the dependency stage in which if you stop, there's so much this withdrawal syndrome. So you just like go the flow. You're now hooked.
Yeah.
And then now you become a full-time addict. That's the next stage, in which if you want to stop, you can't. Social support, you can't. Even when you want to do it, there's all it's taken into your head that you have to take me all the time. There's this craving all the time, and exactly for it. So those are the basic stages, and mostly in our society, you notice people, especially for alcohol use, they are in that dependency stage.
Yeah.
In which you are so dependent of alcohol, you cannot do without it. If you don't drink, you see anxiety, won't move around. So all those stages exist.
That's a good point. Wow, that's a good point. So now let's discuss some of these illicit drugs that we've been talking about. Let's take now cigarette smoking, tobacco use. What are the possible health effects in general from Khalifa Kamara?
If I can take the tobacco use.
Okay.
That is one product that even there was a research done in the US.
Okay.
And they discovered that the death because of tobacco use is more than HIV and even alcohol.
So something we don't even think about that often. Yeah.
Because for the use of tobacco, it affects nearly every part of your body.
Right.
Even for women, your cervix is being affected. Cervical cancer can
be... It increases your chances.
So there are so many effects that you will get. For instance, the major one is our lung cancer. And you tend to get about you have 25% more prone of getting lung cancer as a smoker compared to those that are non-smoker. And you get more in women than in men. About 25.7 times more in women than men, which is just 25. So again, to our biology and the like. So as I said before, it's affecting nearly every part of your body, starting from the mouth right down. So there is a lot of adverse effect associated to the use of tobacco.
For sure. And as she started saying, when we're talking about cancers, lung, mouth, throat, tongue, all of those things possible. But there's also an issue of secondhand smoke. I mean, we don't want to make it seem as if you're not smoking and you live in a house where there are other people who are avid smokers, you're not at risk. So if I'm...
Well, they call them passive smokers. And I mean, in fact, studies have come out that they mostly develop quickly a tobacco tolerance, but they're not smoking because of they have somebody at home who's a first-time smoker. So there's if you have baby, your child at home, make sure. That's why if you go to many public spaces,
that's a valid point.
Yeah, you stick to the area for smoking because
especially with families.
Exactly, because you're not only harming yourself, you're harming others. So these are some of the issues that you have to bring out concerning cigarette smoking because it affects others very much as it affects yourself.
Exactly. And when it comes to pregnant women, obviously that's one of the things your practitioner will talk to you about too. If you are already a smoker and you get pregnant, you have to stop smoking because there are so many risks that can happen with regards to your baby. We're talking about low birth weight for your baby. We're talking about preterm labor. You can have placental abruption and increased infant mortality as well. You might deliver a healthy baby, but then there's a higher chance of that baby dying within maybe the first 6 months of life if you continue smoking. We also find out that these women sometimes they stop smoking during pregnancy sometimes, and then they start almost immediately after childbirth, and that's also hazardous when it comes to that period where you want to be taking care of your child, and as we're talking about secondhand smoke.
A craving.
Yeah,
well,
the craving.
That's a craving, because during pregnancy, most time women develop habits.
Yeah.
That are not doing before they get pregnant.
Right, right.
So you see them picking up alcohol, drinking, smoking,
as we say, yeah.
Some, they can only say they call snuff and local language. Some
okay,
women
for here.
Yes, they chew on it. All kind of habits during pregnancy, but that's physiological and it's normal.
Okay.
Well, it's normal scientifically.
In terms of craving, but not craving for cigarettes, for sure. Thank you very much. Well, viewers, you're watching the Women's Place show, coming to you live on Channel 33 AYV Television. Our topic of discussion today is women's health and drug abuse. I have with me Fam Marie Khalifa Kamara and Fam Shwari Balat. We are going to take a short break and we'll be right back after these messages.
It's 2020, a brand new year with many resolutions, right? But is being a successful actor part of it? Aha! AYV will make that dream come true. AYV Films will be holding a 3-day audition to be judged by famous producers and directors from Africa on 14th, 15th, and 16th of February 2020 at the Sierra Palms Resort at Aberdeen. The audition forms will be available for free at any of our AYV offices nationwide from 20th January up until 6th February 2020. Please bring along your audition forms during the audition at the venue. Don't miss this golden opportunity to make your acting dream come true and become a famous actor.
Good evening, viewers. Welcome back to the Women's Place show, live on Channel 33 AYV Television. We are discussing women's health and drug abuse. I have with me Fam Marie Khalifa Kamara and Fam Shwari Balat. We are talking about illicit drug use and over-the-counter drug use, but drug abuse and drug misuse mostly in Sierra Leone. We're going to be opening the phone line soon. You can call us on 025-271-959. That is 025-271-959. So we're just going to continue with the discussion. So we just went through tobacco use and smoking with regards to how it affects health in general, and then health with regards to the pregnant woman. So now let's talk about alcohol. Alcohol, how does that affect health in general? From Kamara.
It has similar effects to smoking as well. The only thing, it's if you're close to me, you will not be a second-hand.
Yes, okay, that's true.
Yes,
so it only affects you.
It only affects you.
That's a good point.
And it also affects your entire being.
Right.
And so when you drink and it gets to a point where you are addicted to it.
Right.
You want to drink more because it's mostly we tend to classify alcohol as a depressant because even after all the excitement, you get to a point
you're just low.
Yeah. So it weakens a lot of things. Even for men, it's a possibility. It's a risk for infertility. It's a risk for hypertension. It's a risk for diabetes. So it has so many risks for the general population, both men and women. But for women in particular, and especially in pregnancy, it may result in miscarriages, low birth weight. They are very, very much similar to that of smoking cigarettes.
Smoking, yeah.
Yes. So there are some research that tend to tell you women that do take alcohol, especially, and they tend to reduce as they go to the last stage of pregnancy.
Right.
And because alcohol is something that you can be addicted to, and again, you have to depend on it, it also affects the baby. So even after the baby is born, there is an effect on the baby as well.
Right.
So before, during and after.
So it goes right across the spectrum. Yes. Anything you want to add to that?
As a public health concern, she spoke about the medical hypertension, diabetes, and the rest.
Right.
But then there is, if you could check the police record, it'll tell you increased domestic violence due to alcohol.
Right.
So don't say it don't affect you because I won't drink it. It's indirectly.
That's true.
If you have a husband or a partner who is drinking,
Yes.
definitely when it comes home, you definitely there'll be domestic chaos and health, violence, and then road traffic accidents, all those things. I'm sure that the youth not being responsible enough because alcohol affects the decision-making process in the brain. So then you don't. They give you chores, maybe you have that you do have from work, or if you're going to school, you don't pay attention to your work, your assignments, your health, you don't pay attention to your sanitation, your cleanliness, all those things. Alcohol, it affects
so it affects right through. That's true. You just made a point that I wanted to stress on with alcohol use, the fact that you lose your inhibition, so you're not able to make those informed decisions that you would otherwise make if you were not consuming alcohol. And when you make those poor decisions, you put yourself at risk for things like STIs, for things like unwanted pregnancy. So it's very important that if you do consume alcohol, you do it responsibly, as we're saying. And Kamara has already mentioned the effects on pregnant women. For sure, there's no doctor who would talk to you about, yes, take just a little bit of alcohol during pregnancy. Because she's mentioned, there's nobody who would say that, right? I mean, I know in terms of, but I know there are studies that talk about a little bit of wine when it comes to it, like heart health. Yes, it helps a bit. But during pregnancy, for sure, nobody would talk to you about taking alcohol because we're talking about congenital abnormalities that your baby might have, the low birth weight we've talked about, preterm delivery, and Kamara has mentioned the effect on the baby, the alcohol fetal syndrome. So it's very important that pregnant women, the moment you know you've missed your, even if you do socially consume alcohol, the moment you've missed your period and you suspect that you may be pregnant, it's just best that you stop taking it. So now we're going to go to cannabis use. So I know that's cannabis. Yes, marijuana. Marijuana use. So that's something that's, I'm sure, prevalent in Sierra Leone. So what do you have to say about that with regards to health?
Well, concerning marijuana, it's not good for the health, for the body. And especially with our youth, it gives the similar effect to alcohol, in which you have that withdrawal from society. I mean, you're not responsible enough. It will become hyper all the time. You want to, it's affects individually differently. Depends on physiological being, but in general, that's what's happened. But then, when it comes to that, for those that don't have the medical grade,
right?
So you have marijuana, which the medical grade, in which they are used to cure diseases, for example, asthma, epilepsy, in which studies have shown that they reduce the amount of episode. But then that should not be misused. So there should be a fine line between the medical use and that's in which they're abused for recreational purposes.
Exactly. So it's definitely, I know, I mean, it's a social drug. It can be a social drug, but when it comes to your general health, same way. So I'm not, with regards to obviously pregnant women, same thing. Nobody, if you're thinking about getting pregnant, if you're thinking about, if you know you're pregnant, it's not something that you want to engage in. And same thing now you've talked about opioid, especially when it comes to the youth. But you also have female use. I mean, it affects male use, but please go through that opioid use.
Well, it's not just, I don't think it's common because of the cost. Because
that's a good one.
Youth mostly will not involve in opioid, meth, cocaine, because I mean it's a bit expensive. So that's why they're going to cheaper option. You see them using codeine, cough syrup that's a bit cheap, because once you have that legal high, you see them using tramadol. Well, now because now tramadol is a bit expensive and restriction on their sales have been affected, you see now they're moving now to more innovative way.
I know, right?
Boiling Pampers now to extract the dyeing agents in which...
So we definitely do have a problem when it comes to drug use, because it seems as if we find all sorts of ways to get that, you know, transient high. So it's a very important thing. Viewers, you're reminded that you're watching The Woman's Place on channel 33 AYV television. You can call us on 025-271-959. We're going to continue now. And we've talked a bit about females and the effects of these drugs with regards to drug misuse or drug abuse. We've also touched on males to satisfy Fam Balat there. But now let's talk about adolescent, like specifically. I mean, that's a very vulnerable target group when it comes to drug abuse in this country. Fam Balat, what can you say about that?
In fact, at that particular age, let me say adolescent age from 14 to about 17 years of age. That's how the addiction starts. 13, 17 now to 25 years of age. Okay. At that point, your brain has not fully developed. And that is very important. So when you continue taking drugs, become dependent on it, it affects your brain development.
Exactly.
And so the physiological point of view is, teenagers, I mean, you should start from that point at schools to enforce it. That drug abuse as a counsel, then the parents should be involved, because at that stage, if you see you miss them for life, they'll be in and out of rehab centers. So, because if you take it, you affect your brain, then you can't coordinate well.
Exactly. You cannot be able to concentrate.
Your relationship with the community, you become a dropout, and then become a criminal. Violent behavior. I mean, you just become an outcast. Yeah,
and so, especially in this country with poverty, it's like a cycle. A cycle, exactly. If you drop out of school and all the rest of it, so it's very important when we're talking about adolescent health. But all of this tells us that we have huge roles to play when it comes to regulating proper dispensation of drugs. So, Khalifa Kamara, what do you think is the role of the pharmacy board? I mean, with regards to regulation in general. Okay.
Maybe before I talk about the role of pharmacy board, I just want to say something on adolescent health and drugs. Mostly it's not just on the use of illicit drugs, drugs abuse. Even drug misuse is so common. We know at this particular age, peer influence is very, very high. And so I remember there was a time I was talking in a particular pharmacy, and when I went to the wholesale place, I deliberately didn't ask for emergency contraceptive pill. Okay. And the guy, the salesman, was saying, "Boss, you see, no Biden titty and granates."
That's what it's called?
Oh, yes. So I was like, what's that? Okay. He said it's emergency contraceptive pill. This is one of the contraceptives that is being misused, and it's getting to a point that I would say it's been abused. Yeah, because
that's what the eye pill.
Yes, the eye pill. Yes, there is a reason why it is called emergency contraceptive pill. But if you're planning to go and see your boyfriend and have sexual intercourse, go on a regular contraceptive, because it has a lot of effect. Even when you look at the dosage of the active ingredients in emergency contraceptive pill compare to the normal, it's so higher. So there are so many effects. And again, this other idea of after my menses, I have to use antibiotic, like Ampiclox. So I'm cleaning up. What are you cleaning? Yeah. So it's not just with illicit drugs, even with prescription drugs.
So what do you think the role of the pharmacy board is in with regards to that?
So I guess as pharmacy board, they really need to enforce the regulation. There is a law, there is an act that is guiding the practice of pharmacy in Sierra Leone. All we need to do is to go by that act. And one of the things, we have list of drugs, those that are OTCs, those that are prescriptions. So if you have somebody coming to your pharmacy and asking for a prescription drug and without a prescription, it's a no. Go and get a prescription. We shouldn't replace prescription drug for OTC.
Right.
And so these are some of the, we just need to enforce. Enforcement is what is needed because we have everything. We have the guiding tool. As pharmacy board do have it.
And I think I did say what is the role of the pharmacy board, but I think pharmacy owners or pharmacists as well, they also have a role. I mean, we have to stop looking at this from the business perspective and look at it with regards to how do we promote the health of our citizens. You're smiling. So everybody who owns a pharmacy, you definitely have a role to play when it comes to that. And make sure that prescription drugs are only sold to people with valid prescriptions. So I think that's important. So now that we're in a country where you don't have to have a valid prescription for procuring these medications, you're at risk of drug resistance, for example, or treatment failure. So Fambalat, what are your thoughts?
Famari mentioned an important point in which the women, most times after they've seen their menses, they go and take antibiotic. And now we heard about antibiotic resistance, or in the broad term is antimicrobial resistance.
Exactly.
Let me just explain briefly. We have mostly affected by bacteria, virus, parasites. So these are all the microbes in a nutshell.
Yeah.
But then,
germs.
yes, the germs. So when they said antimicrobial resistance, now the drugs that are involved are developing resistance. So for example, if I have to slap you 5 times for you to cry, and then after some time, I slap you 5 times, you didn't cry, I have to increase maybe 10 times before you can cry.
Right.
So the bacteria, they are developing sensitivity to the drug.
Exactly.
So after some time, you're taking, let me say 500 milligrams of amoxicillin, you're taking twice daily. The bacteria develop resistance, and that doesn't do them anything. You need to increase the dose. So after you do it over and over again, they develop resistance, and then you have to think about changing the drug. Or going to the lab, going to the lab again to develop new antibiotics. So that's what's happening now. The abuse of antibiotics, mostly, as you say, going to the pharmacy and getting drugs without prescription, because most of it are antibiotics are prescription drugs. So what they do get them without prescription, people abuse it. They take it all the time, and then it develops resistance, and you get well. So all these issues need to be looked into, and counseling needs to be involved, especially among the ladies. Ladies are so fond of, as I said, I say fond because they like taking medicines, even when they are well.
I think, well, I don't quite agree. No. I don't quite agree, but I do know, yes, it's an issue. I mean, it's a very important issue when it comes to, especially young women at that age. Right. But definitely what we want to make sure viewers out there know is that don't self-medicate. I mean, I have the symptoms, so I think it's this, so I'm going to the pharmacy to get this medication. Make sure you seek proper health care at a hospital or clinic where they do proper testing before you are treated. I mean, don't take antibiotics, especially for symptoms that you may have and you've already decided that I think this is the reason why I have this fever or I'm feeling this way, because you're promoting resistance. There's going to come a time when we won't have antibiotics for, treatment of these infections. So it's very important that, people know that. Fambalat again, what treatment programs are there for addiction? Do we have any, for example, in Sierra Leone for people who are addicted?
Yes, as I mentioned, formerly the mental hospital, Sierra Leone Psychiatric Center, I know they do have a treatment program. They're well-trained, qualified nurse there, and also the doctor are present. I know they have a treatment plan. So for now, that's the only center I'm aware of that they do have some kind of treatment plan. But then when I was speaking to the medical superintendent, he said most of psychiatric cases can be solved at community and home level. So let's get the family involved.
Really?
Get the
So
community
it's not just
involved.
a hospital
If you take it
issue.
to the hospital with drugs, I mean, you lose the family support. So most times, let the person be in his community, in his home, and then engage the parents, the sisters, the family support be around him. That's the key to pull to.
Okay.
In most cases.
That's a
Yes.
Okay, when it comes to treatment.
Treatment,
so we
exactly.
do have something at the
Well, I know,
psychiatric.
yes, you have that. Well, I think that's has implemented at community level. But in most cases, they have to talk to the population because when they say you're mental, people
I know
stay away from you.
there's a stigma when it comes to that.
So they don't stay away from it. There have been cases in which
Yeah.
people just dump their relative at the hospital and then disappear. And then they don't want to take them in again. So this will have proper counseling sensitization that mental cases, you need to, it's about family support. And
because we have to know what the root cause, the root causes are when it comes to the drug abuse. I mean, I don't think anybody would just want to do something. There usually are underlying psychosocial issues. So that's why talking about community support and family support is definitely important when it comes to that. But we are hoping that, as you said, it was mostly males admitted at that facility, right?
Yes.
But so taking into account what Khalifa Kamara had said with regards to the differences in biology or sensitivity levels, it's good that treatment programs are able to cater to both when it comes to that, for sure. Viewers, you're watching The Woman's Place live on AYV Television, Channel 33. Our topic of discussion today is drug abuse and women's health. I have with me Farm Balat, Shari Balat, and pharmacist Mary Khalifa Kamara. You can reach us on 025-271-959. We're going to continue because we know that usually we ask pregnant women to seek care from a hospital, from a registered facility, but we do know that people do take medications on their own. What advice in general would you have for women who do know that they are pregnant with regards to drugs?
Okay. When you want to take drug as a pregnant woman, make sure you read the label carefully. But if you don't understand, you have a health personnel, you have your doctor. Talk to your doctor. Talk to your pharmacist. They will tell you about drugs that you should take or should not take. Even drugs that you can just go over the counter and buy. Some of them have effect on your baby and also on you. So you have to be careful about the drugs you take. And also for pregnant women that have other diseases, they also need to be careful with the drugs that they will take. They definitely, for anything you want to do, well, as long as you're pregnant, try to have a conversation with your healthcare provider. They will tell you, for instance, if you are hypertensive, maybe the drug that you're taking or the drugs that you are taking when you were not pregnant, you should not take them when you are pregnant because it's going to have an effect on the baby as well. So try to communicate all the time. Even for the drugs that normally when you're pregnant, they say, okay, take the prenatal vitamins. Some of them have issues. You don't need to take them over the dose. Because when you take them above the recommended dose, they also have other effects that they will pose to both of you and the baby, because you have a connection with the baby a lot. And so drugs do pass through the baby. So for pregnant women, please make sure all the time before you take even the medicine that you would consider as simple. Though for us, there is no simple medicine.
There's nothing that's simple.
No simple medicine.
Everything could possibly
communicate with your healthcare provider.
So yes, go ahead.
And what makes pregnant women so sensitive? Pregnant women and children. Because when the manufacturers are doing their clinical trials, they don't use pregnant women and children
at all.
They use normal adults. So after they have their results, then they try to do approximation because the dose for pregnant women and children. That's a
very valid point.
So that's why.
So you never know the effects on them.
So that's why the prescriber and the pregnant must be very sensitive what they put into the body, the drugs, because it's no two individuals are the same. You can react to drug differently. You can react to drug differently. So you must always remember that. Consult your prescriber.
And in that line, healthcare personnel, they do have a huge role with regards to talking to their patients,
exactly.
right? Talking about possible side effects, knowing about, as you said, which drugs are excreted in breast milk.
Counseling.
Yeah.
Yes, so counseling is very important when it comes to healthcare providers knowing or taking their patients through which drugs they should take and the possible side effects. Now, you've already actually touched on it, from Khalifa Kamara, with regards to drug myths. You started talking about antibiotics after menses, but just go through those drug myths for us. There are some misconceptions out there.
Yes. The way we tend to, because our environment, we exposed to the drugs that we want.
Exactly. We can just get it anywhere.
So we can just get it, which I guess we'll have to address going forward. And so if I'm taking a particular medicine and I think my friend is sick and she's having similar signs, I will ask her to take the same thing.
Same thing, right.
So these are some of the things that we need to stop doing, because when it comes to drug, we are reacting individually.
Yeah.
Even when we go to hospital, if you say your prescription, your doctor say you have this and this and it's the same disease, they may give you two different medicines,
drugs, right,
because of the way our system is built.
Exactly.
So we really need to adhere to what is needed for us.
Right. Okay, that's a good point. Thank you very much. Yes, you wanted to add something?
Yes, and also one common abuse, people usually take antibiotic when they have cold.
Oh, yes.
That's very, very wrong. Most of the cold infection are caused by viruses. So it's like I said, waste water per back. Just wasting your time, waste your money. So for cold, just let the cycle go and just take your infusions and the rest, so you get better.
All right.
Stay off antibiotics.
Thank you very much. Okay, so we're just going to go to our last word. So since you started, stay off antibiotics for sure, but do you want to add anything else to your last word?
Well, my last word is, especially to drug abusers, the family should not neglect them, because in most cases you see, if you're on drugs, the family just push you far, you're away. I mean, you need a family support.
Right.
So always, family which have developed mental issues due to drugs, the family should bring the person closer. Right. I mean, you need that family support, the love, for it to come back. And also, for antimicrobial resistance, it's a global episode now. So stop buying antibiotics and taking them, self-medicating.
Only the ones that are prescribed.
Exactly, without doctor's prescription. That's key. Or else there will be a time you take the medicine and it will not work.
Thank you very much. And what's your last word from Kamar?
So we've been talking about the patient. So my last word would be to us, the health workers. I think there is a skill which is very important in treatment. Most of the time when we have a patient, some of these patients don't even need medication. Right. They just need counseling. So I think we have to increase on our counseling skills, the information we pass to our patients. When you have a patient, say, doctor, if you not give me this medicine, I know they will. It is your responsibility to counsel the patient, to change his or her perception about that. So to our health workers, to us,
exactly,
please,
do better.
Let's try to do better in terms of
thank
counseling.
you so much. Well, viewers, you have come to the end of our first show for 2020. I believe this has been a good discussion and definitely a great way for us to start the new year. We want to implore the Pharmacy Board to ensure that prescription drugs are sold only with valid prescription from registered practitioners. We want our women to desist from self-medicating, potentially putting themselves at risk for drug resistance and further complications. For sure, drug use, substance abuse in pregnancy remains a significant public health problem, which can lead to severe harmful effects for both the mother and the baby. We want positive lifestyle changes to be incorporated as part of our daily routine for general health, but also in pregnancy, this ensures a healthy outcome for both mother and baby. I'd like to thank the team here at AYV and also you viewers for joining us this evening. We do appreciate your time. To my guests, from Marie Kamara and from Shwari Balat, thank you very much for joining us this evening. Till next time, I've been your host, Dr. Frances Ramatuwuri Sise, wishing you all a happy and a healthy weekend.
watching AYV Television.